Thank you. Good morning, everyone, and thank you so much for joining us today. This is a very exciting day for Northwest Health, Northwest Medical Center Bentonville, our partners, Intuitive Health. We can't thank you enough for joining us in the ribbon cutting of this great facility here, our freestanding ER with an urgent care attached to it. This will be a campus of Northwest Medical Center Bentonville, and hopefully afterwards everybody has an opportunity to take a tour of the facility with us, and we'll give you a couple other updates as we give you a tour. First, I'd like to recognize a couple of folks that are in our community here. We have the mayor of Bentonville with us, Stephanie Orman, so thank you so much for coming. Also the mayor of Centerton, Bill Edwards. From Intuitive Health, they're our partner with this venture here. We have Sandy Black as our regional vice president. David Apple, who's the chief marketing officer, he will come up and give you an update as well. And Stephanie Tucker, community marketing director, manager for Intuitive Health. From Radina, from the developer, we have Gant Braley. And then from Northwest Health, we have Dr. Richards is here. Dr. Richards actually is the medical director for all of our emergency services for our entire health system. So this is going to fall under her umbrella as well. So thank you. And then Pam Cash, if Pam can raise her hand. Where you at, Pam? Pam is the clinical operations manager at this facility. We also have our chief of police here from Bentonville. Thank you so much for coming. The chief fire department for Bentonville, Chief Boydston, thank you so much for joining us. Our first responders, thank you for everything you do every day. For our community and everybody in our health system, we can't thank you enough. Again, we are absolutely thrilled to have everybody here. We're thrilled to do the ribbon cutting on our 11,000 square foot emergency department and urgent care. It's the first of its kind in the area here, where it's combining emergency services and also an urgent care to it under one roof. This could not have been possible without all the folks that were involved in this, our partner Intuitive Health, Flintco, Radina, our corporate offices as well, the folks in our at Northwest Health, and we have many leaders from Northwest Health that are here. We have some people up front all around here. None of this would have been possible without their continued commitment to doing what's right for our community and our patients. This is under this model, patients no longer have to self-diagnose before choosing an emergency room or an urgent care setting. They are only billed for services they're only billed on the level of services that they receive. Before treatment even begins, patients are told the type of care needed and whether they will be treated as an emergency patient or an urgent care patient. Additional consent is required for emergency care to ensure there are no concerns with billing. The quality of our care patients receive in this facility will be the same as a hospital-based facility. The only difference is there's no overnight stays or surgical privileges here. Every patient sees an ER-trained provider regardless of condition. And as we have anybody that needs to be transferred to a hospital setting, we have all those protocols and processes in place. Excuse me. As with all of Northwest Health's emergency departments and clinics, we designed the facility to ensure the highest quality of care as well as safety and privacy and convenience. So a little bit about the facility that you'll have an opportunity to tour. It has 12 private treatment rooms, a trauma bay. We're at the ambulance entrance now, a specialized room for safe care of psychiatric patients, a negative pressure room for patients who require any isolation care. For those who are injured or exposed to chemicals, we have decontamination room and the equipment to go along with it. We provide laboratory services, and also we have imaging services. We have ultrasound, x-ray, and CT. So for now, I'd like to introduce a couple individuals, again, that were very instrumental in making this happen. The first person is our partner with Intuitive Health, is David Apple.
Thank you guys all for coming. Can you hear me okay? I'm from Jersey. I should be able to project pretty well. So this really is a big day. It's a big day for us and for the system. We're really excited. This is our 14th location around the country. Started off in a small growing town, very much like this, and it's not so small anymore, but in Frisco, Texas, where we served about 24,000 people at the time in 2008, and now we're well over 300,000, and in our immediate DMA, we have over 1 million people. So a lot of growth there in just a few years. So really excited to see what's going to happen around here. We're excited to partner with Northwest Health, be a part of that roster of great hospitals and great providers and specialists. So that's really exciting for all of us. And the model is, such a unique model that we're just excited to see what it's going to do to the community, how it's going to affect the families and the growth around here. There's a couple, Patrick pointed out a few, but I just wanted to highlight a little bit. This unique model, it's a dual model. It's a single door access ER and urgent care. And why that's beneficial is, if you think about it, if I have the cold, I know exactly where to go. I'm going to urgent care. If I have abdominal pain or if I have chest pain, I'm looking at the ER. What about the 800 plus things in between those bookends, right? What about your two sons jumping off the refrigerator thinking they're Superman, or dad saying watch this and a metal rod goes through? That's a real, that's not from the internet. That's a real, it's that ability when that patient needs care right now to walk through these doors and get the level of service that they need, and it's great for these growing communities and the families. And secondly is it's ER trained physicians and staff at every level of care. So whether you come in for that cold or you come in for that metal rod sticking through your hand, you have an ER level physician and staff at every visit, which is great. It gives you that confidence. And then it's the customer service. So every employee that's going to work here is trained in a retail customer service model. It creates a lot of efficiency. It creates an opportunity to improve every single day. We have a feedback methodology. So this year alone, we're going to see about 330,000 patients. We have had over 80,000 pieces of feedback. To date, 100% of those are closed. They're all been responded to, and we continue that process. And that allows us to improve every single day and get those families to come back and have a trusted partner in the community. And then last but not least, probably the most beneficial to the model is really only paying for the level of service provided. So you think about, in the U.S., there's about a $400 billion ER spend. About 90 billion of that could potentially have been treated at a lower acuity level, like in urgent care. Not to say it's a problem; it's just something that we're working through. So in here, you only get billed for the level of service that you need. And just to give you some context, that same 300,000+ people that we are going to treat this year at our facilities, 80% of them were treated at the urgent care level. So really, that 20% really were emergency room, and they got billed appropriately. And patients like that. It's a very, quote unquote, no pun intended, intuitive type methodology, and patients react to that, and that's what they've been asking for. So we're really excited about that. We're really excited Bentonville and Centerton and all these great towns being a part of this and growing our relationship with the Northwest team. So look forward to you guys taking the tour. If there's any questions, obviously, look me up. I'd be happy to answer them. And back to you, Patrick. Sure.
All right, I'd like to welcome our mayor, Mayor Stephanie Orman. She's going to say a few words. Thank you, Mayor.
Well, thank you, and I will be quick with my presentation today. But I want to say thank you for the collaboration. So it's exciting to see these type of cutting-edge thought processes, and I hope Bentonville is recognized throughout the United States that that's where we want these things to happen, and we want them to be successful in our community. So thank you to Northwest. Thank you to the partnership that you formed with this. We're excited about this. We want the community to wrap their hands around this new urgent care and emergency care process, and we want it to be successful in our community. So, and thank you for all of our first responders and all of our healthcare workers that are here today. You are amazing. You've been amazing. You've always been amazing, but over the last 2 years, you've been incredible, and we want to say thank you to all of you for that. And again, we want to be here to support you in any way that we possibly can. I have had the privilege to step onto the board for Northwest recently, and I have just been amazed with the quality of your employees, the care and the attention to detail that you put into everything that you do. And so we're excited for this new building and this new opportunity to have high quality healthcare and a initiative for high quality health care in our community. So thank you.
All right, thank you, Mayor. And then we have from the Chamber, we have been a member of both Rogers Lowell and the Greater Bentonville Area Chamber for many years, and we're very fortunate to have the President and CEO here of our local chamber for Bentonville, Graham Cobb.
Patrick, thank you so much, and thank you to everyone from Northwest Health. I can say that as literally a Humpty Dumpty that Northwest put back together again. The care is phenomenal. I hate that I can speak from experience there, but I'm glad that you are in the region to help. This is an innovative and creative approach that not only serves the residents of the greater Bentonville area, but also helps serve healthcare workers. Undue emergency room trips present they put a real stress on our healthcare system. We've seen that over the last 2 years, and we see it more and more. So this creative approach is extraordinarily valuable. And this isn't just an investment in the residents of one of the fastest growing communities in the country. It's an investment in our workforce, and it's an investment in economic development and the businesses that are relocating here. When we get calls, there are 3 things on everyone's mind. It's, can my kids get a great education? What's the quality of life like? Is it safe? Thank you for ensuring that it is. And what about health care? So this approach here, sitting right in Centerton, which has grown, let's see, about 400% from 2000 to 2010, and then doubled again from 2010 to 2020. In Bentonville, I think we welcome about 8 to 10 people every day to Bentonville. This growing community needs investments like this. We appreciate everybody that's made it possible. We appreciate your service on our board of directors and everything that Northwest Health is putting into the region. Thank you so much.
All right. A couple other folks I want to thank. None of this would have been possible without the hard work of our marketing department. We have Abby, who's our VP of the marketing for our whole system, and Christina Bull. She's somewhere, there she is, she's hiding. They have done an absolutely remarkable job here, so we can't thank you enough. And just a couple other names. We have Angela here, that's radiology. Tyra is here as well for radiology. Shane from lab. Here's our administrative team right here. We have Kim Arnold, our CNO, Carrie, our CFO, Whitney, our director of quality. I'm missing somebody. Folks from our system leadership back there, Alex and Jose. Beth, who does absolutely everything for us. Thank you, Beth, as well. Our EMS team here. They have done an absolutely remarkable job, and again, none of this would have been possible. And I know I missed somebody, and I apologize in advance if I did. Mickey and Callie are back there from our ER, and I am so excited about this personally because it brings a much-needed service to our community. And I've been very blessed because I get to drive by here every single day. So I saw it when it was nothing, and then every day I drive by, and if my wife's with me, I keep pointing. That's going to be awesome. It's going to be such a needed service for our community. So again, we can't thank you enough for being here and being part of the community and really supporting Northwest Health. Christina, did I miss anything other than the directions of going up? All right, so we're going to cut the ribbon. We're going to go up front. If everybody would put your mask on, we'll go up front, and the great team here will also give you a tour, and there's some snacks and some goodies in there as well. All right, thank you so much.